Hi, my name is Adriana Nottingham, and I'm going to be your nurse practitioner student, and I'm going to examine you today. Would you like for me to call you Ashley or Miss Waters?
Miss Waters.
All right, Miss Waters. So how are you doing?
I'm good.
Wonderful. So it seems that you are in a good state of health. You are alert and oriented. I don't see any signs of distress. You are well groomed and kept. Your hygiene looks good. You are dressed appropriately for the weather. So I'm going to examine your skin, your hair, your nails, your head, your eyes, your ears, your nose, your mouth, and your throat. Are you ready?
Yes.
All right, let's go. All right, so first I'm gonna look at your skin, your arms. Your arms are intact. I don't see any lesions, papules, or nevi. I'm gonna look at your nails. Your nails are clean. Capillary refill is less than 3 seconds. I'm gonna look at your face. Your face is symmetrical. I don't see any erythema, jaundice, cyanosis, or pallor. I'm gonna examine your hair. Your hair texture is smooth. I don't see any lesions in your scalp. I'm gonna feel your skull. Any pain or tenderness?
No.
Alright. So your skull feels well proportioned. It is symmetrical. I don't feel any bumps, lumps, or depressions. Wonderful. So now I'm going to examine your eyes. So I'm going to feel your eyelids. I'm going to look at your eyelashes, your eyebrows. I'm going to feel your lacrimal glands. Any pressure or pain?
No.
Alright, so I'm going to have you open your eyes. Have you look up. So your sclera is white and clear. Your conjunctiva is pink and moist. And your cornea is not damaged or lacerated. Wonderful. So now I'm going to get really close. I'm going to test your confrontation by doing a finger wiggle test. So you just tell me when my fingers are proportioned in your peripheral.
Yes. Yes. Yes.
Wonderful. Now I'm going to do the EOMs. So I'm just going to have you follow my finger. Wonderful. Now I'm going to test your pupils. I'm going to check for direct and consensual reaction as well as accommodation. So I'm going to have you look right at me. So your right pupil is reactive to light and your left pupil had a consensual response. Your left pupil was reactive to light and your right pupil was consensual response. Now I'm going to have you follow my finger. Now have you look at the wall. Now only move your eyes. Follow my finger and look at the wall. Wonderful. So as I moved my finger closer, your pupils got smaller, and when I had you look away, your pupils were larger, which is a good response. So I'm going to dim the light so that I can check your eyes. So I'm going to hold it in my left hand because I'm going to look at your left eye. So it's going to get really bright because I have to move closer to you, just a warning. I see the red reflex. Your optic disc is creamy and yellow. I can see your vessels in your retina and macula. Now I'm going to do your right eye. You need a break or you're okay?
I'm okay.
Okay. You see the red reflex? So I'm gonna move closer. Your optic disc is creamy and yellow with clear margins. I see your vessels, your retina, and your macula. Wonderful. So now I'm going to examine your ears. So I'm going to have you turn your body towards that way. Alright, so I'm going to feel in your ears. Just let me know any pain or tenderness. So I'm palpating your auricle, your tragus, and your mastoid bone. Any pain, tenderness?
Nope.
Alright, I'm going to go to the other side and do the same thing. Your auricle, your tragus, and your mastoid bone. Any pain?
No.
Alright, so while I'm on this side, I'm going to test your hearing by doing a whisper test. I'll have you slide over just a little. Okay. So I'm on your right side, so I'm going to have you hold your left ear so that you cannot hear anything. Alright. Now tell me what letters and numbers you hear.
2, B, 5.
Great. Now I'm going to go to the other side. Do the same thing. Now hold your right ear.
2, B, 5.
Great. So now I'm going to do the Weber test. So I'm going to place this on top of your head and I'm going to ask you how the sound is after I finish. Okay? Sound stop.
Mm-hmm.
Did you hear one sound greater in one ear or was it equal in both ears?
It was equal.
Great. Now I'm going to do the Rene test. So I'm going to test both ears. So I'm going to make a noise and I'm going to put it on your bone and you let me know when it stops, and then I'm going to put it next to your ear and you let me know when it stops.
Stop. Stop.
Wonderful. So your air conduction was greater than your bone conduction. Now I'm going to go to your right side and do the same.
Stop. Stop.
Great. So your air conduction was also greater than your bone conduction on that side as well. So now I'm going to do your ear exam with my otoscope. So your ear canal is pink. Your tympanic membrane is pearly and gray. I don't see any perforations or bulging or fluid. I can see your handle of malleus, your short process of malleus, and your pars flaccida. Any tenderness as I'm doing that?
No.
Wonderful. So your ear canal is pink as well. Your tympanic membrane is pearly gray. I don't see any perforations, bulging, redness, no drainage. I see your hand of malleus, your short process of malleus, and your pars flaccida. Thank you.
You're welcome.
All right, now I'm going to examine your nose. So I'm going to have you turn towards me again. palpate your nose. Your nose is symmetrical. Any pain or tenderness?
No.
Alright, now I'm gonna look inside your nose. So your mucosa is pink and moist. I bring your chin down. Your nasal septum does not have any holes. It's not deviated. I don't see any drainage. And I see your inner turbinates. Your mucosa is pink. Your nasal septum does not have any holes or deviated. I don't see any drainage. And I can see your inner turbinates. So I'm going to palpate your frontal and maxillary sinuses. Any pain or tenderness?
No.
Great. Now I'm going to look at your mouth. So your lips look pink and moist. I'm going to get a light so I can look inside your mouth. I'm going to have you smile. Your teeth are white. Your gums are pink. I'm going to have you say ah.
Ah.
I don't see any cavities. I'm going to look back. Your posterior pharynx is pink. I don't see any redness. Your tonsils are not swollen. Now I'm going to have you stick out your tongue and say ah again.
Ah.
Say ah.
Ah.
So your soft palate and uvula rises, and your uvula is midline as well. Great. So I'm going to have you stick out your tongue and have you move it to both sides. Alright, your tongue is symmetrical. I'm going to grab your tongue so that I can feel it. So I can say ah.
Ah.
Your tongue is moist. It is pink. I don't see any indurations. I'm going to have you lift up your tongue. Your floor of the mouth is pink. And your top of the mouth is pink. I don't see any lesions. Now I'm going to examine your throat. So I'm going to have you hold your head up. Just going to feel. Your neck is symmetrical. I don't feel any masses. I don't see any lesions. I'm going to palpate your lymph nodes. So this is your preauricular, posterior auricular, occipital, tonsillar, submandibular, submental, anterior superficial cervical, posterior cervical, deep cervical chain, and your supraclavicular. I don't feel any nodes. Was it painful anywhere that I touched?
No.
Great. So now I'm going to examine your trachea. Your trachea is midline. You can feel your sternal notch right below your trachea. I'm going to palpate your thyroid. I don't feel any enlargement or goiter. I'm going to have you have a sip of water while I feel. So So your thyroid gland rose and fell as you took a sip of water, which is good. And I want to come to the back side and have you have a sip of water again. And your thyroid isthmus also rised as you took a sip of water. I don't feel any tenderness or nodes. You feel okay?
Mm-hmm.
Any pain?
No.
Great. So that is all for your exam. Everything turned out well. Do you have any questions for me?
No.
All right. So if anything comes up or you don't feel okay, just feel free to reach out to me and I'll have you come back in.
Okay.
Thank you.
Thank you.